It's now the top of the hour, and I have started the recording. So I'm going to go ahead and get started with the webinar. Before we begin, I'm going to quickly cover a few housekeeping items. The captioning link for this webinar is available in the chat box. Tessa has been kindly pasting it in there for us. Like I said, this webinar is being recorded, and a link to the captioned recording will be sent to all of you via email once we've processed and uploaded it. This can take a couple weeks, so just be patient. Today's slides and the resources guide for today's session are available for download on the class page. The link to this will be pasted in the chat box, and I will also send the link to that along with the recording link when I send that out. On the class page, just scroll down to course materials, and then you can find those files for download. For today's session, you are all automatically muted, so please use the chat box to communicate your questions and comments. I'm going to be asking for lots of audience input today since I'll be doing some live demonstrations. I'll basically be searching for what you want me to search for. We will try to keep it PG so our recording can be family friendly, but start brainstorming some fun image searches that you might want me to do. At the end, after I've done a live demo of the different resources, I'm going to send you on a little scavenger hunt, and you can report back on what you find in the chat. I'll also answer any audience questions that I didn't get to earlier during this time. So if I missed yours the first time around, just ask again during the scavenger hunt. This webinar grants 1 MLA CE hour. To claim the CE, please complete the short evaluation that will open once you leave the webinar. If this doesn't pop up for you for some reason, it happens sometimes, just send me an email, which I will have on the final closing slide, and I will get you the link to that. It's no problem. Please also do fill out the evaluation even if you're not seeking MLA CE, because this gives us valuable feedback on how we can improve our offerings. So now that the housekeeping is out of the way, again, let me just say welcome, and I'm so glad you could all join me today for the August installment of the NLM Health Sciences Libraries webinar series. This series is tailored specifically to health sciences librarians and is aimed at giving you some new tools for your toolbox or sharpening up old tools that you can use practically in your day-to-day work and introduce to the faculty, students, researchers, or healthcare providers that you work with as well. Our next installment will be in October, so keep an eye out at nnlm.gov/calendar for that to open for registration. The Health Sciences Libraries webinar series is presented by a small team of NNLM staff from several regional offices. My name is Kelsey Coles, and I will be your tour guide today. I'm based at the University of Pittsburgh Health Sciences Library System, which hosts the NNLM Regional Medical Library for the Middle Atlantic region, or MAR, which serves Pennsylvania, New York, New Jersey, and Delaware. So I'm the academic coordinator, so I work primarily with academic librarians working with the health sciences in some way, whether these are community college librarians or those who work at a large academic medical center or even a hospital. NNLM serves as an outreach and engagement arm for the National Library of Medicine, which is part of the NIH. And NNLM provides training, funding opportunities, informational materials, and more, all of which are free to our member organizations. Most of you probably are aware of NNLM's work or work at an NNLM member institution, but if not, you can always visit nnlm.gov to learn more about the services we offer. All right, on to the fun stuff. So today, I'm going to be talking about using NLM resources and actually a couple other resources that I felt were worth including to find images. First, though, I'm going to spend a few minutes talking about the importance of visual communication, especially in instruction, but I think these lessons can be applied to all sorts of contexts. Faculty to student instruction, librarian to student instruction, student presentations, conference presentations and posters, print or virtual informational materials, et cetera, et cetera, et cetera. Additionally, images from some of these resources are really great for aiding in diagnosis, can be used for continuing education, and more. And after I talk about that, I'm going to go right into live demoing these resources. I'm going to spend the most time on Medpix and OpenEye, but I'm also going to introduce you to 4 other resources that I wanted to share with you, and those are NLM's digital collections, the Visible Human Project, the National Cancer Institute's Visuals Online database, and the Centers for Disease Control's Public Health Image Library, or PHIL. So now I want to engage you all in a quick poll, which I will open. And I'd love to see which of the resources that I'm going to talk about today you've used before. So I'm hoping that all of you will learn about at least one new resource today that you can take back with you to utilize or share with your audiences. So the poll results are coming in, and I will give you a minute or so to answer that, and I'll give you like a 20-second warning when it's about to close. Wow, these results are so interesting. I will, oh yes, I guess I should have put a none option. I apologize, Melissa. Yes, if you've used none of them, that's totally fine. Just you don't have to answer the poll, that's fine. These results are really interesting. I'm gonna go ahead and hit close, which I think should give you a countdown, but maybe it's not, but I will. So it looks like only 6 out of 70 respondents have used Medpix, 5 out of 70 for OpenEye. The digital collections and the Visible Human Project are a little bit more popular at about 31 out of 70 and 19 out of 70. Only one has used NCI Visuals Online, and only 15 out of 70 have used Public Health Image Library. So that's actually really exciting. I thought these numbers would be a little bit higher, but I'm really excited about this because that means that hopefully you'll all be learning some new resources today that you'll find really useful, and that's my goal. All right, so as promised, first I'm going to spend a few minutes talking about the importance of images. And I'm sure I'll say this again, but this isn't necessarily just to convince you of the importance of visual communication, but also to give you some ideas for communicating that to your audiences who maybe aren't so excited about learning about yet another place to look for information, right? So I thought I would go for some irony here by talking about the importance of images on a slide with only text. Some citations for these are located in the speaker notes on these slides. So if you download them, you can see the footnotes that are on the slides. So images are really useful for a few reasons. First, visuals can increase retention of the information that they're paired with. People often remember a fact better if it's associated with a relevant image. For instance, studies have shown that people who use visual memory devices can remember word lists better than those who try to remember the lists just by repetition. So, for example, it's easier to remember the words dog, horse, road if you picture or you're shown a picture of a dog riding a horse down a road than if you're just repeating dog, horse, road to yourself. You may have heard the old wisdom, and this came up a lot on the internet when I was doing some research for this. You see it everywhere. People say people remember 10% of what they read, 20% of what they hear, and then depending on where you're getting these numbers, 50 to 100% of what they see. These percentages, I want to be upfront, are basically a myth. There are many other factors at play, and regardless, these numbers can vary widely between individuals. However, there is truth to the general idea that visuals can enhance information retention, especially when those visuals are easy to understand, relevant, visually striking, elicit an emotional response, or some combination of the above. In other words, learners aren't usually helped by decorative but boring stock photos. All right, second, humans process visuals much more quickly than text. So MIT researchers found that the human brain can process and identify images seen for as little as 13 milliseconds, or that the brain can process an image something like 60,000 times faster than text. The portions of the brain dedicated to processing visual input are much larger than those devoted to processing words. So images can help you get your message across quickly and efficiently. Third, visuals can elicit emotional reactions. Some studies have found that heightened emotional states are tied to improved information retention, but emotion also helps on a simpler level with attention and audience engagement in general. So images that elicit an emotional response, whether that's disgust, humor, fear, happiness, or something else, can just help people pay attention and therefore remember more. In addition to the fact that images associated with information can aid the retention of that information regardless of any emotional response. So it's sort of a two-for-one deal. And finally, there's a reason the saying, "a picture's worth 1,000 words" is so popular, right? For some images, it really might take 1,000 words or more to accurately describe. An image can often convey information much more efficiently and faithfully than text. And this is why it pays to be smart about where to use figures, diagrams, and images in written articles. So for a little fun example, last summer I was on a sports team and we played a sort of team-building game, supposedly. So we sat back-to-back with a teammate. One person was given a simple drawing that they had to describe to the other person verbally, who had to draw it without seeing the drawing, of course. So for most pairs, the drawing didn't quite look like the original image. Some folks were close, some were just comically far off. And while I sort of question the usefulness of this as a team-building activity, it does do a good job of illustrating the idea that images can get information across more efficiently and faithfully than just words. I do want to take a moment to pause here and point out a major caveat with all of this, and that's that images are not accessible to everyone. So it's really important that you consider that when using images and make sure that the information conveyed by an image is also conveyed with words or text in some way. For online materials, this often means adding alt text to your images and adding captions to your videos. There are some nice automatic captioning options out there, like on YouTube. And images from some resources, like many images on OpenEye, actually come with alt text already when you copy the image and paste it into, say, PowerPoint, which I actually found out when I was making this presentation. Regardless, it's not that hard to add alt text to your images in a presentation or just on the internet, and I highly recommend you do so. And also, if you're just presenting in person and you have images, try to describe those verbally alongside your presentation. So now that I've spent a lot of time talking to you with a lot of words and not a lot of pictures, I want to give you some examples that are a little bit more visual. And so as we look at these, think about whether these are sticking with you more or less than all of the words that I just said to you. So on the left here is a radiograph, and on the right is descriptive text describing the injury in the image. Share your thoughts with me in the chat box. Think about, which side do you think gets the message across faster? Are you more likely to remember the image or the text? Does seeing the image help you understand or remember the text? Does the image give you any sort of emotional reaction? I'll give you a moment to observe and react in the chat box. Yeah, look, we're getting some responses. Curtis says, ouch, and Margot says, looks painful. Jeanette says, image gives me a visceral reaction. Yeah, and that's the exact reaction I had. So I chose this image because I used to be really interested in osteology, and I studied lots of broken bones and whatnot. And I love this because I can picture this image in my head days after I put it in this presentation, and I know exactly what it's illustrating. Whereas when I read that text, I really have to think about it to visualize it. And yeah, the picture shows that there is a problem, and the words tell me what the problem is. So in a way, they're sort of working together and sort of building on each other as well. So I think this is a good illustration of how images can get a message across quickly and really, elicit a response, but sometimes the text is also helpful, and they can work together to convey information. Awesome. Thank you for your reactions to that. All right, next example. So this is an image showing temperature trends across the globe since 1990. And I think this is a good illustration of how an image can faithfully convey information that would probably take me hundreds or thousands of words to describe, and it would be less effective. So I was trying to think about how I would go about describing this image more than just saying something really general like, well, most of the map is yellow, orange, or red. And I was having a hard time, right? There's a lot of information conveyed here. I think this type of image, kind of like the first one, can also be a little bit of a gut punch and maybe elicit some emotional reaction like surprise that might make this information more memorable. So on the topic of emotional responses, I think this 1980 anti-smoking advertisement is a pretty good example. So I've actually covered up the image in the advertisement so you can just see the text for now. It's not in English, but the textual message reads, "Stop smoking, improve your health." And that's a pretty mild message. I don't think reading that alone would have a huge effect on me. But if we uncover the rest of the image, it's pretty striking. And this is a pretty morbid image with a skeletal hand holding a cigarette. And the association between death and smoking is obvious. And at least for me, this elicits a bit of a feeling of dread or fear. And I don't recall if these particular ads have made their way into the U.S. yet or not. I know there was a proposal, I think, last year to do so. But this made me think of those really graphic warnings on cigarette packaging around the world that show some of the physical damage that can occur due to tobacco use. Excuse me. And some of these are pretty graphic. I actually still remember some of the ones I saw in like health class, which must have been at least 15 years ago. And this is actually an interesting example for another reason. Some studies have shown that these graphic warnings are actually not as effective in leading to smoking cessation as many had thought or hoped. This might be due to several reasons, one being that smokers generally already know that smoking is dangerous, so the graphic warnings don't always translate into action. This discussion is probably a little bit outside of today's scope, but I will say that there is evidence that these graphic warnings do increase knowledge about the dangers of smoking more effectively than text-only warnings, even if this knowledge doesn't translate into action. So if you didn't come into this presentation convinced by the importance of visuals in communication and learning, hopefully by now I've convinced you. If your next question is, great, but where do I go to find high-quality, relevant scientific images? Hold that thought for 1 second, because I also want to take a moment to convince you that when looking for pictures, Google Images might not be the best first stop, surprise, even though it might be the most obvious or a very easy choice. And again, I'm not just telling you this to convince you, because really, I'm fairly certain that this audience is probably one that would need very little convincing of that concept. But I'm hoping to give you some tools to utilize when you're talking about these resources with the faculty, students, or healthcare providers you may work with. I think students especially are probably highly likely to just Google it. So I think it's important to be able to describe the value added by other resources, even though those might take an extra click to reach. So when you go to Google to find health information, what are you going to find? You're probably going to find some good information. You might find links to peer-reviewed articles, which you might want. But there's a high likelihood that you're also going to find things like blog posts, popular science news that may or may not accurately reflect actual research, clickbait headlines, oversimplified information, and probably some absolute nonsense too. And then you have to do the work of sifting through all that. And the same kind of holds true for Google image results. Not every image you get is going to be what you're looking for or even really related to your search. You may get a lot of stock images, and I will show you this in a moment once I switch to sharing my browser. But like I mentioned before, people recognize stock images and tend to tune them out, so they don't necessarily add to learning like a more relevant or engaging image would. And they tend to be a little bit more decorative, which can also be a consideration if you're thinking about the accessibility of your presentation. You can filter your Google image search results by license type, but this can unnecessarily narrow your results if the license type of an image isn't known, or use restrictions could be labeled inaccurately. Images from the resources I'm going to talk about today are, on the whole, free for use with attribution, or in some cases, which I'll show you, you will get more specific copyright information available to you about a particular image. Images found on Google results can be distorted, edited, cropped, compressed, and this lowers their quality and reliability. Images can also be mislabeled by not even actually be pictures of what you searched for. And if the searcher doesn't have the expertise to tell the difference there, they could make a significant error. Images in Google results could be from a peer-reviewed article, or they could be from a blog post. Using Google means that the searcher has to add an extra layer of information quality assessment as they determine whether a source is reliable, whether it has accurately described the image, and whether it's used that image accurately in context. Images can also be misattributed or unattributed, making it difficult to determine their original source. And one nice thing about OpenEye specifically, which you'll see in action, is that if you pull up an image from an article in PubMed Central, it will also show you the other images from that article. So this can be really nice if the first image isn't quite what you needed, or you just wanted some more visuals for the same concept. And although as librarians, you're probably pretty good searchers on just about any platform, some of the ones we'll look at today just have better and more relevant tools to customize a search. OpenEye in particular has some really cool filters that I'll share with you that bring some functionality that Google just doesn't quite match. And finally, starting I think last year, Google began adding ads to image results. And so this means that sometimes when you do a Google image search, you may have seen this, you might see paid advertisements or links to shop for things on the top of the results. This is annoying, yes, and it also alters the actual search results by pushing some things up to the top of the results that might not be really what you want. So as promised, I'm now going to switch over to some live demo. And so the links to all of the resources that I'm going to show you today, plus short descriptions of them so you can remember which one's which, can be found in the resources handout, which is available for download on the course page. And once we get to the part of the presentation where you're going to be able to interact with these, we'll paste the links to all of them in the chat box as well to make it easy for you. So I'm going to be starting off with Medpix, which I think only like 9% of you said you had used before, so super cool, a new resource for many of you. Medpix is a free open access online database of medical images, teaching cases, and clinical topics. So it's not just an image database, it's actually a really nice education tool for healthcare providers, health sciences and medical students, and more. In fact, the site actually offers the ability to get some CME credits, so that may be of particular interest to your provider audiences. And I see someone in the chat already says our faculty use it and love it, so that is great to hear. So on Medpix, you can browse cases by diagnosis, which I will show you here. So you just go to cases and by diagnosis. This brings up a not very visually appealing all caps list of diagnoses. But I'm just going to start here to sort of show you what a page looks like. So I'm just going to click on one sort of at random. We've got the abdominal aortic aneurysm, AAA, diagnosis here. So here is a case for that. And what you can do is sort of page through the images and take a look at those. And on the right-hand side, what you'll see is some case history about the patient, exam and findings, differential diagnosis, treatment and follow-up, and then there's just this discussion section. So these are all submitted by the people who submit these cases. So doctors can go in and say, I've got an interesting case that people could learn from. I'm going to put my information in there with some images so that others can learn from that. So sometimes these discussion sections, and this is a good example, are really excellent. They've got lots of details. I've seen some that link out to literature that gives information about differential diagnosis for this particular case. This one links to some related cases. So this one's really nice. On others, I will say that you won't see a discussion section at all. So there's some variability there. You can also, like I said, you can contribute a case. So if you go to cases, you can contribute a case if you've got a practitioner who wants to share. And there's also an API, which is actually offered through OpenEye, that allow you to download cases that fit your specifications. Let's see. So if you have someone, Ellen, I see your question, and I am going to address that momentarily. If you have someone who does want to get AMA CE credit, CME, I keep saying CE because I'm used to MLA CE, you can go to CME. There's a guide here for how to do it, or you can just go to choose a case, and it's going to pull up a list of cases that offer those CME. So I'm just going to choose this one, and then you can either view or view in quiz mode. So the first one we looked at, we were just viewing. So this one, I'm going to show you what it looks like in what's called quiz mode. And what happens is you see it blurs out all the information. So you can just look at the pictures and the history and try to come up with your own diagnosis for this. And to get those CMEs, what you're going to do is go to quiz over here. And again, not all cases have quizzes, and not all cases with quizzes offer CME. But it will be very clear at the top. So this says, to record CME credits, please log in. So you'll make your little account on Medpix, log in, and then you can get the credits. If this quiz didn't give CME, there'd be a red warning at the top. So you wouldn't be, quote unquote, wasting your time taking a quiz that didn't give credit if that's what you were after. Now I want to point out the topics section. So this is a way to browse cases that are organized in 3 different ways. So the first one is the American College of Radiology numerical system. So that just sorts them by basically different body areas and systems. You can sort by location and category. So category, we have anatomy, aneurysm, etc. For location, this one's a little funny, so I kind of wanted to point it out. I think these are probably pulled from basically user-submitted data, so that's why there's some weird ones in here. So for instance, there's 171 generalized abdomen cases. There's also 3 in Bethesda, Maryland. So I think how people interpreted the location was a bit different. So I would say when in doubt, just use the search. So let's do a demo search. Type something in the chat box that you'd like me to search for, and I'll just grab one at random and we can do a search, and I'll show you what that's going to look like. While those suggestions are coming in, another good thing to know about Medpix search, I did some testing here, and the AND operator appears to work as you would expect it to. For some reason, not and or, at least right now, are both acting like and, which is pretty goofy, but something to keep in mind if you're doing a search. All right, we've got some suggestions. I'm just going to grab kidney stone. Let's see if we can get some results here. Yes, it looks like we have some cases. So I'll just click on one at random, and then it's going to pull up some description here, and it's going to highlight your search terms in it so you can quickly see if that's something that you wanted to look at. So again, here's another what another case looks like. This one again doesn't have a quiz, but you can turn on quiz mode by toggling here. See quiz not available, but if you go back to the case, it'll blur everything for you so you can quiz yourself. So Ellen, in response to your question in the chat, if you're interested in using these images, all of the images, the case images on Medpix are available for personal use and for teaching, so you can include them in teaching materials, syllabi, etc. You can post them on your course page, like Blackboard or whatever for students. For uses beyond that, they ask that you contact the author for permissions. Luckily, it's easy to find the author because there will be this little author tab here, and you can see image author, affiliation, and then you can try to find their contact information and get any permissions that you would like. So I have not seen any other questions about Medpix in the chat. Does that include course packets? Yes, I believe that does. I know on here there's, I sort of summarized the usage restrictions, but there's some more details somewhere on this page, and I believe they said that does include like course materials, Teresa. All right. So I don't see any other questions about Medpix. Let me close a couple of these tabs. Do they all require additional permissions? So all of the Medpix case images, basically when you upload them, you're agreeing to upload them under a certain usage agreement, and that is what I described, that folks can use them for teaching purposes and personal purposes, but anything other than that, like publication or something, you would want to get permission from the author. All right, so moving on, this is probably my favorite NLM resource, and I just always talk to people about it because I find that a lot of people don't know about it, and actually only like 7% of our poll respondents have used it before, so I'm super excited here. This is OpenEye. OpenEye is an open access biomedical image search engine. If you think of Medline Plus or PubMed as alternatives to Dr. Google, then OpenEye is the alternative to Dr. Google Images. So I mentioned earlier how different your results can be on, say, Google Images versus a specialized resource for medical images. And I promised a demonstration of that, and I'm going to deliver. So here we have the Google search results, Google image search results for diabetes. Lots of very pretty stock photos of people doing finger prick blood glucose tests. We've got diabetes here spelled out in some cute little letter beads. But if you're looking for something a little bit more scientific or academic or medical, this isn't probably quite what you're looking for. So I'm going to do that same search in OpenEye. As you can see, the images look dramatically different. What OpenEye is doing is it's searching articles that are in PubMed Central, and it's searching several special image collections, one of which is actually the Medpix database, to pull in all these images. So it's sort of like an umbrella search tool. And I like to point out that even though it is searching Medpix, so you'll see the images, it's still good to know about Medpix and the other collections that it's searching, one of which I will show you next. Because OpenEye is just showing you the images from those, but it doesn't have all the functionality. So it's not going to obviously give you the quiz that you would get on Medpix about a particular image. It'll just show you the image, and then you can link to Medpix and do that. But it's still good to know about the individual collections and resources themselves. So let me show you some of the features of OpenEye. Most of them are pretty self-explanatory and intuitive, but let's get you involved again. Let me run a new search with something that you want to look at. So give me some new suggestions in the chat box, and I will use one of those for a demo search. Deer tick bite. Ooh, let's try that one. Let's see what comes up. Oh, nice. Okay. All right. That looks good. So here's our sample search. So let me show you some of these the features that you can use to modify your search. Again, self-explanatory and intuitive for the most part. You can rank your results by newest, oldest, diagnosis, etiology, outcome, prevention, treatment, etc. You can sort by article type. So maybe you only want things that came from a systematic review. You can select for that. A lot of times you're not going to get a ton of results if you do that. But you can even sort for obituary, which I guess, I don't know. I've never found that many results using that, but maybe as more things are added, you'll find more. This is my favorite. It's filtering by image type. So you can do CT scans, graphics, MRIs, photographs. I'll select photographs and see what comes up. I want to point out that some of these are very obviously not photographs. And the reason that this is happening, we've got a nice little cow down here, that's very cute. The reason this is happening is because these are done by an algorithm. So basically the computer is looking at the pictures and saying, okay, I think that looks like a photograph. And I see a lot of crossover if I sort by MRI, you get a lot of X-rays because they're both sort of like black and white images that tend to look fairly similar. So you'll get a little bit of crossover there, but for the most part, it does a pretty decent job. Let's see, what else? We've got these subsets. So for instance, there are subsets of journals in PubMed Central that are clinical journals, ethics, etc. And it will only search for those if you want to use one of these subsets. I don't use this one quite as much. The other one I really like is collections. And I'll show you a couple of these. So again, like I said, it's searching PubMed Central, it's searching Medpix, it's searching images from the History of Medicine collection at NLM, which we'll look at next. And it's searching these two other ones, Indiana University Chest X-ray collection and this Orthopedic Surgical Anatomy collection. So I'm going to click on chest X-rays, knowing that deer tick bite won't pull up anything, but I'm just going to clear deer tick bite and photographs, and we'll see if we can view. So here we're basically looking at the entire collection. Ellen, I don't think there's a way to just limit to color or black and white. Probably the closest thing you would do would be to just select a few of these that are going to sort of mimic that type of search. So here's the chest X-ray collection. This one's really cool. It kind of reminds me of Medpix a little bit. It's a special collection of images that give you some information about the patient. So here's the age is unknown, but here's a male with chest pain. So it'll tell you a little bit about the patient and if there's any pathology that someone who's looking at this should be seeing. So if you got students or folks who want to review a lot of radiographic images, this is a great place to start. Other things to point out on this page, there's going to be some information about the copyright policy. So this one is open access, and there's a link out to any license restrictions. So each image will have those. Let's see. Let me go back and find you an image that was in a PubMed Central article. Here's one. So when you mouse over that, what you're going to see is some article information. These are really adorable little mice, and it's going to give you, once you click on that, it's going to give you sort of a snippet from the article. I think this is computer generated, so it's not always perfect. And it'll also show you additional figures from that article, which I mentioned before. And again, you can get the copyright policy and license information here. So for this one, it's probably going to be like contact the journal of publication to get whatever permissions you're looking for. Let's see. There's a question, can you select multiple categories simultaneously? I believe yes. Let me just confirm that. Let's do photographs and graphics. For some reason, OpenEye always likes to be really slow when I'm demoing it. There we go. Yes, so you can select multiple things simultaneously, and then there's just a little X if you want to clear them. Stuart, are the limits standardized, or do they and the subsets dependent on the search topic? As far as I'm aware, they are standardized. Let's see. Anything else here I wanted to show you? Do you have any other questions? If so, please type them in the chat. I think that's mostly what I wanted to point out on OpenEye. You can also sort, just like on Google Images, you can sort by license type, filter by license type on OpenEye as well. All right. Well, if there are not further questions on OpenEye, I will move on to the NLM digital collections. Thank you, Shar. I agree. OpenEye is fantastic, and I'm very pleased that I got to share it with you all today. So yes, so the digital collections, one of which is the images from the History of Medicine collection, which I'm circling with my cursor here. OpenEye searches that, but there are also a number of other collections here which are super interesting if you're looking at the history of medicine. There's a World War I, there's a World War II. This one's my personal favorite, Medicine in the Americas, 1610 to 1920. There's historical books and journals. It's really cool. I'm going to focus on the IHM History of Medicine collection because this is all images, and a lot of these other collections include lots of digitized documents, so the books, other publications, letters, and things like that. And I really just want images for our purposes today. So I'm going to go to Images from the History of Medicine, and I'm just going to do a little search that I want to do, which is Pittsburgh. And I like to do this one because the first result is the Mellon Institute, which I used to work directly across the street from. I think this picture is from the early 1900s. It looks completely identical today, which is kind of cool. But for an example, I'm going to look at this third image here. I'll pull up the page. So this is an anti-cocaine commercial from the 1980s. It was put out by the University of Pittsburgh Student Health Service. And so this page will give you some information about the image. It's got an abstract, which is actually pretty nice if you want to use it for alt text. And it will have copyright information. So because this is from the 80s, it's likely that there's some copyright protection on it. So the owner is probably the University of Pittsburgh in some regard, and you could probably contact them if you wanted to use it in some substantial way that you think wouldn't be covered by fair use. Some of these are very old, and they will say NLM believes this item is in the public domain, and if it's in the public domain, of course, you can pretty much do what you want with it. Also want to point out that you don't have to browse the collections. Let me just get back to the main page. You can do a search, of course, and you can limit by whatever formats you want. So if you want just a still image, you can do that, and you can search for, let's put Pittsburgh in again, and see we get some of those same results. Any questions about these digital collections? So these, I think, are really great if you've got, a faculty member or someone who's talking about the history of a particular illness or its treatment or just the history of medicine in general. Even if you have like a student who needs to do a research project and they're not sure what to do, but they're really into history, maybe they can browse one of these collections and find a topic that really excites them. So I think this is really fun, and I like to just play around in here sometimes. All right, I'm not seeing any questions about this one. I'm going to try to click. Oh, I did it without disrupting the WebEx bar at the top. Next up is the Visible Human Project. I always want to call it the Visual Human Project. This is actually from the 90s, but I think it's still pretty cool and useful. And this is a collection of detailed anatomical images of a human male body and a human female body. The images available include cross-sectional cryosections, CT, and MRI images. And these images are all available for download and are now considered basically in the public domain. So you can use them however you like. You can view some sample images if you don't want to download the whole data set. So I'm going to scroll down. I'll just we'll look at a CT sample image. It's a little bit dark. Hopefully you can see it a little bit, but this is, I think there are like thousands of these that you can download. And I think these are cool for folks who are maybe teaching or learning anatomy, so you can show certain anatomical structures in various different views. So you can say, here's what it looks like in the fresh cadaver or the frozen cadaver. Here's what it looks like as in a CT scan view, and here's what it looks like as an MRI. So this is pretty straightforward. It's basically an image collection that you can download and use the images in whatever way you like. So I know this class was titled NLM Resources for Images, but there are actually two other resources that I just thought were too valuable to not make you aware of, even though they're not directly from the NLM. The first comes from the National Cancer Institute, and it's called Visuals Online. And this is pretty simple. It's a searchable page containing images from NCI's collections. These are sorted into some featured image collections, Science and Technology, Childhood Cancer. I like this one, Spanish language diagrams. Those could be useful. Anatomy, historical images, and B-roll videos, which I haven't checked out yet, but I'm kind of interested too. You can also browse images by topic. So I'm just going to pick one at random here. Let's look at leukemia, and it'll pull up a few pictures relating to leukemia. And you can, if you get more than 4 results, you can limit by date. You can sort by image type. This one you actually can, Alan, sort by black and white and color. And you can sort by date added. One thing that I'd like to point out here is if you just use the search bar, I'm just going to put in leukemia again, you actually get more results. And I think probably the reason it just pulled up these first 4 is because they have a higher relevance, and that's why they were added to that topic, whereas some of these other ones have a lower relevance score. But I would advise, if you're not finding quite what you want to use by using the topic, to just use the search bar and then see what you might find in addition to that. All right. Would these be usable in presentations? I think most of these are, I want to say they are freely available. Let me check if there's specific information. Yes, so here, most of these are going to be public domain. Each image will have a description, but since these are from the government, basically, most of them are going to be, if not all, are going to be public domain and are free for reuse as needed. They do ask that you credit the source and creator if possible. Excellent question. All right. And then the final little resource I want to share, this is the CDC Public Health Image Library. And Phil offers us a number of topical collections on subjects like influenza, natural disasters, bioterrorism, health behaviors, lab science. There's a bunch of them here, and those are featured image collections. But the thing that I actually like a lot about Phil, and that I think you folks might find useful, is this specific audience page here. And there's a bunch of different audiences, and what these different sub-pages are pages that are, they contain a few tailored image collections for a particular audience. But the really cool thing, and I'll click on healthcare providers to show you. So here's the featured images. The cool thing that they do is they basically tell you how to pitch this resource to that audience. So you don't have to do any creative thinking about it. This makes it really easy, and it just tells you the Phil can help healthcare providers by illustrating the effects of disease or supplementing case notes, assisting diagnosis, and hospital teaching. So if you're like, hey, doctors, you should check out the Phil, you already have some talking points to sort of get across some ways that they might be interested in using this resource. And this is just an easily basic searchable library. You can narrow down by photos and illustrations, but it's pretty straightforward. So with our remaining time, and I want to re-emphasize that during this time, I'm happy to answer questions, but I want to give you folks some time to sort of have some free play with these resources and play around with them, because I know sometimes questions can come up or comments once you actually start using the resource yourself. So we're going to be doing a little scavenger hunt, and we're going to look for images on some certain topics. Again, ask any questions you have during this time. I'll answer. But what I want you to do, I'm going to give you a topic, and I want you to go to any of these resources and find an image related to that topic that you think would be useful to one of your audiences in some way. And then come back in the chat box, give a brief description of the image. So say, I found this nice image of the coronavirus on the Phil, and I think my doctors would be interested in using this because they are giving lots of presentations about coronavirus right now, something like that. So what you found, where you found it, and why you chose it for a particular audience that you have in mind. And I've chosen some really broad topics on purpose because I want to see a wide range of responses that are going to illustrate sort of the breadth of what's out there in these resources and the different uses for it. If you can, try to use a different resource for each prompt. And I will be here. I'm probably going to mute myself for a minute, but I will be active in the chat box. And your first topic to go search for in any of these resources is influenza. So let everyone know what you find. And I'll be here to answer questions. Very good. It looks like we're starting to have some responses coming in. It looks like a lot of folks were interested in the historical aspects of influenza. We have some things found in the digital collections. Very good. A Chicago poster about the 1918 pandemic. A public display, a run on disinfectants is nothing new. Another digital collections one, very good. Stuart found the same poster as Margot. Looks like Bradley went to Medpix and found a good picture for pneumonia. Very cool. And Ellen went to OpenEye. X-rays from case reports, very good. Oh, someone went to Phil, historic photo. Phil found a video about the symptoms of the flu. Good job, Phil. And someone else used Phil as well. Very cool. So it looks like just about every resource was utilized. I'm not surprised no one went to the Visible Human Project. That wouldn't be probably the best resource for this. Yeah, Pam, that's interesting. I bet it has something to do with, Pam said when she combined influenza with H1N1 and Phil, it produced no results, even though some images have H1N1 in the description. I imagine that's something to do with the metadata on the images. But yeah, so that's a good illustration of why you might want to run multiple different searches in these types of resources to make sure you're finding all of the images you would like. Let's just do one more. Let's do, the topic is liver. So let's jump into a different resource than the one you used before and share with me what you came up with and who you think might find it useful. Looks like we have one response so far. Lucy went to the NCI Visuals Online and found a nice illustration of liver anatomy that could be useful for students or patient education. Ellen, you are correct. The Visible Human project does not have a search box. It's more of just a bunch of images that you can download. Yep, and it looks like the NCI Visuals Online is a good resource. Give you another minute or so if you found something cool that you'd like to share with everyone. Yes, Claire brings up a great point. The NCI portion on liver anatomy also has Spanish language images, which is great. Bradley went to OpenEye, found some various liver MRIs that could be great for med students or residents to use. Very good. Stuart found a fun one, an advertisement for a product to disguise the taste of cod liver oil. I mean, that's really something that we all need in our lives, to be honest, right? We all are trying to disguise the taste of cod liver oil. Very cool. Pam says NLM Digital Collections has both still and moving images. Yes, some research viewing copy available on-site only. I suppose they having it been digitized or something like that, or maybe yeah, they just need someone to actually go to the site to see it, which is unfortunate in today's times, but hopefully in the future. Awesome. Well, instead of running us up against 1 o'clock and doing another one, I think you've all had a little chance to play around with these, and I really hope that you learned some new resources today. Let's see, Mary, I see you have a question. So I'll say up front, I am not an intellectual property expert. The permissions, so on most of these, they're going to give you like a link to a license that will give you some more information, and free for use outside of, open access or public domain. It can have some different varying restrictions on what context you can use it in. For instance, if you can say, I'm just using this for teaching, it's fair use, I'm not widely distributing it, you may not need permission. And yes, that is completely the hardest part. Whereas if you're saying, I'm going to use this in a publication, the odds are much, much higher that you will need to get, written permission or pay a licensing fee or something to use an image. For the most part, the images in these resources, some of them come from the government, which means that you are mostly allowed to use them for whatever purposes you need, or if they're coming from like a PubMed Central article, like on OpenEye, it's going to give you, it's either going to tell you what the license information is, or it'll say like contact the journal or the author, and they would be able to help you out with that. So unfortunately, there's not really a good like broad answer that yes, you can use every one of these images for everything you want. I wish that were the case, but these are great resources because probably the proportion of things you can use here and these are way higher than in other places that you're going to be looking. Yeah, Elizabeth, classroom teaching and webinar teaching is different, and the license matters. Yeah, it is a constant struggle, and you always kind of have to be a little careful. So I'm going to wrap it up a couple minutes early so we can make sure you can get to your 2 o'clock appointments. Thank you so much for coming today. I really hope you learned something new that you can apply. I had a great time today showing you these resources. Please join us in October for the next installment of the series once that goes live for registration. And if you have any further questions today, shoot me an email. I would love to hear from you. I love talking about OpenEye and these other resources. My email is kac221@pitt.edu. So I would love to chat with you if you're interested in talking more about any of these. And have a great rest of your day. Thank you so much for coming.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.